My name is Nick, and I had eyelid surgery. Went to my eye doctor. My eye doctor recommended it. My mother had it, so it was hereditary. I had a tough time seeing, and so I started looking for a plastic surgeon. I had a very good friend who had some work done and raved about Dr. Gross, and that sold me. So I was looking for a plastic surgeon. I asked a lot of questions, asked a lot of friends, looked on various websites, and then I had a friend who was very knowledgeable of the various plastic surgeons in the area, highly recommended Dr. Gross. So I went to see him, had an appointment set up.
When I first met Nick, it was most striking for the fact that he'd spent a lifetime in the sun and that he was a swimming instructor, a professional swimming instructor. So he definitely had accumulated a lot of sun damage, and as a result, some of the skin on the upper eyelid area was getting a little droopy. And he also was having trouble with some of his vision. So I was really excited to help him both with the cosmetic appearance of his upper eyelid area as well as lifting and improving the vision for him.
My first experience was, obviously I was nervous as I'd never had anything like this done before. I'd heard many horror stories. Went and saw Dr. Gross, found him to be very friendly. He made me feel very comfortable, explained the whole procedure to me. I met his supporting staff, and I left there feeling very comfortable. On the day of the procedure, not sure what time I went in, but I know it was early morning. Obviously somewhat nervous, as I'd never had anything like this done before. Met the staff, they put me at ease, explained what was going to happen. I got dressed, prepared for the surgery. I don't remember much after that. They just explained to me that within a few seconds I'd be drifting off to sleep, which I did. I woke up sometime later, not exactly sure how long I was under, but I came back consciousness, very comfortable, relaxed.
So it's very important for male patients to have a hidden incision from the blepharoplasty or upper eyelid lift. And in Nick's case, it was very important for him that he looked very natural. In the surgery, we make a very low and flat incision for the men and tailor it so that it hides inside the crease. And we use very small micro stitching so that you don't see really any suture line at all. Afterwards, there's a few days of swelling, and Nick was very good about icing the area, and he had a beautiful result. By the end of 7 days, we got his sutures out, and he looked like a champ.
The day of the procedure, I had a very good friend who drove me in, and she stayed with me through the whole procedure. She sat next to me for a good part of it, and then obviously they don't want you to drive home, so she was there to take me home. Upon my arrival home, I just started to ice, and rest. I had no idea what to expect after the surgery. The pain level was fairly high the first day. My face was quite swollen. I didn't see much of it because I was covered in ice. My face was covered in ice the entire time. And there was some severe swelling, I guess you could say. And then with the ice treatments and rest, I found that by the second day it had subsided. There was far less. And then it was just a gradual procedure after that. More and more ice and less swelling. The procedure was recommended to me by my eye doctor strictly from a medical standpoint to help my vision, but it certainly made me look a lot younger as well. I'm very happy I chose that procedure, and every time I look in the mirror, I'm just very thankful that I went ahead with it.
In Nick's particular case, he had difficulty with his vision because of the excess skin, and as a result of the surgery to help him improve his vision, he actually looks 10 years younger, which we see in a lot of our male patients. It's the #1 surgery that they come in for help for is upper eyelid lift. And Nick had a beautiful result.
I'm very, very satisfied with Dr. Gross. To me, it was a very difficult decision because you only have one face, and I wanted to make sure that I put it in the best hands possible. I think I chose an excellent doctor in Dr. Gross. I continue to go back to see him for facials and so forth afterwards. I've not had any other medical procedures, but if I did have in the future, I would certainly go back to Dr. Gross.